زين عندنا هنا هذا scheme for the types of fistula. هذا واضح مثلا هنا عندكم فيزايكو فاجينال، فيزايكو ثروفاجينال، الفيزايكو يوتران والفيزايكو سيرفايكال، وهنا عندنا يوثروفاجينال تايب between the ureter and the genital tract. واخر شيء عندنا هذا ريكتوفاجينال فيستولا بالصورة الثانية. زين نجي على الاتيولوجي of the fistula. عندنا either congenital genitourinary fistulas are rare with only 10 cases reported in the literature. طبعا الأكوار تكون أكثر. It's thought to result from either abnormal fusion of the ureteric bud and the caudal end of the Mullerian duct with the urogenital sinus. زين or from incorporation of an aborted ureteric bud. زين when يصير into a future Wolffian duct remnants. These fistulas are usually associated with other renal or urogenital abnormalities. هذا كي تعرفون يعني أي abnormality بجنتال tract بعد الدليفري يخليني أفكر ب abnormalities of the urinary tract. زين الأكوار طبعا هو الموست common. Most vesico-vaginal fistulas do not arise from developmental abnormalities but follow obstetric trauma. هذه مهمة. In developing countries احنا مثلا 90% of genitourinary fistulas arise from an obstetric trauma, especially from prolonged or obstructed labor. Obstructed labor or malpresentation of the presenting fetal parts can cause pressure or ischemic necrosis of the anterior vaginal wall and bladder. هذا البرشر مستمر راح يسوينا بالاخير نيكروسيس. زين من يصير pressure of the presenting part على anterior vaginal wall والبلادر, subsequently resulting in fistula formation. Alternatively, vaginal trauma may result from damage by instruments used to deliver stillborn infants or perform operation. مرات iatrogenic هذا creation of fistula. Malnutrition and limited health care in many of these countries further complicates wound healing. هذا حكينا عليها compounding factors. In contrast, in most developed countries, على عكسنا احنا developed countries, fistulas uncommonly follow obstetric procedures or deliveries. On rare occasions, cesarean deliveries, usually those accompanied by obstetric complications, have led to complex urinary fistulas. طبعا هناك أكيد يعني extra care, tertiary centers for delivery, monitoring is better. ماكو عندنا obstructed labor. يعني case to case يعني nurse to patient أكو هناك care. زين فالcomplications تصير بعد شنو مثل السيرجريز مثل cesarean section. Pelvic surgery in developed countries, iatrogenic injury during the pelvic surgery is responsible for 90% of vesico-vaginal fistulas, and the accepted incidence of fistula formation after pelvic surgery is 0.1 to 2%. Genitourinary fistulas are related to surgery by obstetrician, gynecologist, urologist, colorectal, vascular, and general surgeons. In industrialized countries, hysterectomy is the most common surgical cause of vesico-vaginal fistula, accounting for approximately 75% of fistula cases. زين laparoscopic hysterectomies were associated with the greatest incidence, followed by abdominal and vaginal hysterectomies. إذا نيجي بالدرجة الأولى اللاباروسكوبيك type of hysterectomy. Because most genitourinary fistulas have an operative etiology, prevention and intra-op recognition of lower urinary tract injury is imperative. Use of intraoperative cystoscopy has been shown to improve the detection rate of lower urinary tract injuries. أكيد راح يخلي ear detection for its occurrence. It's found that in hysterectomies performed without cystoscopy, the ureteric and bladder injuries have crude occurrence rates. لذلك هناك عندهم أي hysterectomy لازم the urosurgeon is present والcystoscope موجود. With intraoperative cystoscopy, the detection rate of these injuries increased. Thus, the implementation of routine cystoscopy may be a useful adjunct in the detection of lower urinary tract injury during hysterectomy. This in turn may ultimately result in the lower incidence of genitourinary fistula. زين other causes غير obstetric trauma وغير surgery. Other causes although surgical and obstetric causes account for most urinary fistulas, other causes have been reported and include radiation therapy, malignancy, trauma, foreign bodies, pelvic inflammation, inflammatory bowel disease. Other rare causes of fistula formation include lymphogranuloma venereum in multiple هيصير عندنا هنا fistulas congenital region, urinary TB أيضا syphilis and autoimmune disease. Moreover, conditions that interfere with healing such as poorly controlled DM, smoking, local infection, peripheral vascular disease, chronic steroid use and malignancy are risk factors. هذا يعتبر risk factors يدخلنا tissue perfusion. Clinical presentation. Vesico-vaginal fistulas classically present with unexplained continuous urinary leakage from the vagina after a recent operation. تيجي تقول أنا أدي fed watery discharge. يجوز مرات ما تميز urine. Depending on the size and the location of the fistula, the amount of urine will vary. مرات قليل مرات هواي حسب السايز واللوكيشن مالتها. Occasionally, small volume intermittent leakage is mistaken for post-operative stress incontinence. For this reason, patient with a new onset urinary leakage should be examined thoroughly to exclude fistula formation. أي وحدة تشكي بعد مثلا hysterectomy, pelvic surgery, complicated surgery, prolonged مثلا chant labor تشكي من continuous leakage. زين نفكر بالurinary fistula. Other less specific symptoms of genital urinary fistula include شرط ضمن fever, pain, ileus and bladder irritability. هذول بالذات جماعة ureterovaginal fistula. Vesico-vaginal fistula may present days to weeks after the initial inciting surgery, and those following hysterectomy typically present at 1 to 3 weeks. Some fistulas, however, have longer latent periods and can cause symptoms a number of years later. قسم حتى سنوات.